Hey, it's time for the big one. Before we get into it, I need to disclaim that COVID 19 is a developing situation. New information is being released every couple of hours, so if something retroactively invalidates an event that I've described in this video, that's okay. I promise you it won't be the end of the world. Neither will COVID 19, but let's talk about that. Here, I have a timeline of some of the most important milestones of COVID 19, starting at December 31st, 2019. On that day, the WHO China Country Office was informed about cases of pneumonia of unknown etiology detected in Wuhan City. Scientists in China were able to isolate this virus by January 7th, 2020. This was very big news, as the speed with which the isolation was done was unheard of. But we will learn further down the line, this may have been an effort to compensate for something else. By January 11th, 2020, WHO learns from the NHCPRC, or for short, that the outbreak is being associated with exposures in one seafood market in Wuhan City. 2 days later, the first imported case of lab-confirmed COVID-19 is reported in Thailand. I'm going to break down the terminology in the last sentence for you, as I know this jargon can get overwhelming, but believe me when I say that the differences are not arbitrary. Imported case means a person who was exposed to the infection while traveling away from home. This means someone caught the virus and then brought it back to their home country. Lab confirmed is just that. This means that doctors were able to perform scientific tests to confirm the existence of the virus in said patient. Great, let's move on. By January 21st, 2 more countries report cases, Japan and the Republic of Korea. And on January 25th, over 1,000 global cases of COVID-19, including 2 in the United States. Now, January 28th SITREP has an interesting spike. 4,593 confirmed global cases, with another 6,973 suspected, and 106 dead in China. We're actually going to jump ahead straight to February 3rd, where there are 2 things of note. 17,391 cases confirmed, but more interestingly, the development of a quote-unquote 2019 NCOV kit by both technical experts in health operations and WHO operational support and logistics. Just want to give an honorable mention to February 8th, where 64 cruise ship members became infected and were at the time still stuck on the cruise ship in the ocean. Some of the sick have since been transported to land, and I'm sure that that'll be the last that we hear of it. February 11th is, sadly, when WHO reports 1,017 deaths in China. With this, I would actually like to take a moment to address any misgivings you may have about the virus not being important because it may not affect you. Let me introduce Timothy Snyder, who is an American author and historian specializing in the history of Central and Eastern Europe and the Holocaust. He once wrote, quote, "As anyone who has lost a loved one knows, the difference between 0 and 1 is an infinity. Though we have a harder time grasping this, the same is true for the difference between, say, 780,862 and 780,863, end quote. I believe that the same adage holds true here. Just because it is 1,000 deaths from a foreign country does not make it any less significant. Now for the present. March 1st, 2020. More things of note on this date. First, the number of confirmed cases in the Hubei province of China had increased for 2 successive days after a period of decline. The number of globally confirmed cases is 87,137, and there are now 104 deaths globally. That brings this timeline to a close, but I haven't been completely straightforward with you. That was actually the timeline strictly from the WHO. Things began to jump out at me, and instead I've decided to also present you with a different timeline. Citations will be provided in the description so you can verify this information for yourself. Before we begin, I'm going to venture a guess and say that you're skeptical. Why would the WHO lie? They wouldn't, at least I don't think. The issue lies with China and its relationship with social media and censorship. Let's start this timeline a little later back than our original, November 31st, 2019. On this day, Chinese medical professionals noticed an unidentified strain in several people. Come December 10th, 2019, the original group study count starts, which means they were actively recorded and noting potential cases of COVID-19 by middle December. This ties into the rapid discovering of the COVID-19 strain because Chinese health professionals were already aware of the virus and working on isolating it before they let the rest of the world know. Overlapping with the original timeline, China lets the world know about the virus on December 31st, 2019. The screening and testing measures are heightened in China by January 3rd, and the first death was reported on January 11th. This is where things begin to spiral out of control. Last month, Zhao Jinwan, the mayor of Wuhan, said that 5 million people had left the city before travel restrictions were imposed ahead of the Chinese New Year. This would give a direct explanation for why the disease was able to find homes in 24 other countries. Consider that, not more than 2 weeks after the first death due to COVID-19 and at least 41 reported cases, 5 million people made their way across the entire globe, all coming from Wuhan. That strikes me as slightly concerning, to say the least. The Wuhan lockdown begins on January 23rd, and a day after that, the Hubei lockdown. To tell you the truth, these citywide lockdowns would require their own separate videos. Suffice to say that highly populated Chinese provinces are quite literally ghost towns at the time of this writing, all because of the fear of catching the virus. Just to give you a few numbers as well, it's roughly 11 million people trapped in Wuhan and 52 million people everywhere else. February 4th and February 7th. On the 4th of February, the day after the WHO released the 2019 NCOV kits, they had to be recalled as it was found there were issues identified relating to a problem in the manufacturing of one of the reagents, which led to laboratories not being able to verify the test performance. I don't know what any of that means, but admittedly, it doesn't sound like they're off to a great start. But on the more important day of February 11th, one of the original physicians who tried to ring the bell on the disease died due to the coronavirus. This normally wouldn't be worth mentioning except for the fact that she was a woman in her 30s with no previous respiratory issues. It is important to highlight that with the information we have now, the mortality rate is much higher in the elderly who are already sick compared to 30-year-olds who are not sick. Just some food for thought. Feel free to draw your own conclusions to the matter. And the last important day so far, the 26th of February, saw the first case of unknown origin in California. China has historically proven their unwillingness to be completely transparent when it comes to national issues. Unfortunately, I do believe that they were wrong in not reporting the unidentified virus to the WHO employees sooner than they did. It would be sad to think tens of millions of people are locked in their apartments and may only be there because the NHCC refused to take preliminary reports more seriously. Now, I know you have questions, and actually, I forgot something. A few of you may remember that on January 11th, the NHCC reported the outbreak originated from a fish market. This was only recently discovered to not be the case. I'm going to post a link to the UPI article that provides more details on this, but the prime takeaway is, according to Taiwanese press reports, the first patient identified by the surname Chen was a resident in the Wuchang district of Wuhan. Chen had never visited the seafood market and had been cured and discharged, reports said. Consider that another wrench in the original timeline I presented. On that note, I'd like to share a personal opinion I have about COVID-19. As morbid as it sounds, I think people are panicking for the wrong reason, and with potential misreports and incorrect statistics. And yes, with every death being as significant and traumatic as the last, this pandemic has illustrated our entire world government's lack of preparedness. I'm not talking about entertaining a Resident Evil Raccoon City level event either. With a CFR of 10% or 15%, I think it's fair to assess those numbers would have a tremendously devastating effect on most of the developed world. And consider the unprecedented effects it already has had at a reported CFR of only 2.4%. South by Southwest being cancelled, sending countless ripples through scores of industries, Japan closing its grade level schools down, and the general panic that has been spreading across the Eastern Hemisphere and is now slowly encroaching on the West. Sadly, people will die because of incompetent bureaucracy that's only purpose is to fill a quota or meet a budget before the end of the fiscal year. Life is too fragile for us to be so broken over the political strife of these representatives whose top interest is not their constituents, but it is themselves. Yes, I'd like to answer some of the questions you have now. The questions will be timestamped in the pinned comment. Question 1. Will I get sick? Answer. That depends on where you live. I personally recommend to follow the World Health Organization on Twitter and stay on top of the news tab in the app. At the time of writing this, Western countries are woefully underprepared to handle containment of the virus, and it doesn't look that's changing anytime soon. There have been 2 incidents in which personnel were not correctly equipped to handle the transportation of Americans who were evacuated from Wuhan, China. None of these people showed symptoms, but also were not tested due to faulty kits provided by the CDC, the ones that we spoke about earlier. Question 2. Should I start wearing a mask? Again, this depends on where you live. According to the WHO, if you're not showing respiratory symptoms, you do not need to wear a mask. The use of masks is more important for those already showing symptoms, those taking care of infected patients, and healthcare employees. Rational use should be applied, and it is important to remember the most effective way to prevent infection is to wash your hands frequently, avoid touching your face, especially your eyes, mouth, and nose, and cover your sneezes and coughs with the inside of your elbow, not your hand. Question 3. Is it time to start stocking? Answer. At the time of this writing, yes and no. Yes, you should always be prepared with at least 2 weeks worth of provisions. This could be as simple as canned foods, dry cereal, water, and toilet paper. There's no need to go completely overboard as of right now. Getting extra soap and a few masks certainly could not hurt any efforts to keep yourself uninfected, but remember, the more you buy, the more you're taking away from health professionals or other individuals whose priorities are a little higher to need it. Question 4. The world is ending. Why isn't everyone panicking? Answer. Well, simply put, the virus isn't that deadly. It's common to find comparisons of COVID-19 to SARS and MERS, and I would like to expand on that, but maybe in a different video. For now, here's a quick rundown of the numbers. The case fatality rate, or CFR, of SARS is roughly 9.6%. For MERS, it is about 34.4%, and for COVID-19, it is 2.3%. We are going to take a closer look at those statistics that make up COVID-19 CFR in another video soon as well. Question 5. What is COVID-19? Answer. COVID-19 is the infectious disease caused by the most recently discovered coronavirus. In humans, several coronaviruses are known to cause respiratory infections. So, COVID-19 is the name of the disease that comes from a coronavirus, which is why you may see or hear people mention other coronaviruses. These are not to be confused with COVID-19. And there you have it, folks. 2 timelines of the spread of COVID-19 side by side to help illustrate the holes in the narratives most of us are being forced to listen to. Please use this information wisely and to your maximum benefit. Unfortunately, the situation is developing daily, and this probably won't be the last time I cover this. Thanks. No, I can't do this. These videos aren't made in a vacuum. And unfortunately, I sat on this for too long, and more milestones have happened in the last week since I've recorded. We're going to future-proof this video for another couple of days and do a lightning round of the stories and facts you need to hear. Let's be real about one thing. COVID-19 is here to kill the sick and the elderly. It has come to chew bubblegum and kick ass, and it is all out of bubblegum. The mortality rate for those who are mechanical breathing is over 80%. The United States does not have the test to administer to those who are presenting symptoms. So keep this in mind when the CDC releases any new statistics, that the data is fundamentally screwed for the fact that everyone who needs testing, very few people can actually get it. As I'm recording this, in New York, not even in New York, across the country, there are only about 2.66 million coronavirus tests, and they can only be administered to about a little under a million people. I think it was 988,000 people to be exact. And they can only do 16,000 tests a day. Insurance company CEOs held a presser where they discussed waiving the $1,000 cost of getting tested, which is nice, but there aren't any tests to actually use. So all of Italy is on lockdown as the disease spreads. Top officials across the US, UK, and Iran are all confirmed to have the virus, and several are already in quarantine. This is not some faraway concept that may or may not affect you at some point. This disease kills. I kind of already wrapped up my sentiments about the disease earlier, but just today, Dr. Anthony Fauci said, things will get worse before they are right now. Maybe, he should have opined that a few weeks ago. You're a little late to the party, Tone. Regardless, now you have decent enough information, baseline of information, to not be misled or misguided into believing something about COVID-19 and the outbreak. But do not let this leave this video without understanding one thing. This is a global pandemic. Even if the WHO can't admit it yet. Whether it will inspire change in the powers that be is yet to be seen. I'd bet on safe and say that it won't. Thanks again. Wait, goddammit. Of course, as I'm finishing writing the recent update paragraph on the WHO, they go and record that quote-unquote that COVID-19 can be categorized. That's a tough word to say. COVID-19 can be recharacterized as a pandemic. As of today, COVID-19 is officially a global pandemic. Hopefully, no new breaking news stories will release from now until I get to my computer. Fingers crossed.